Namaskar. I am Dr. Animesh Kar. I am a neurologist attached with R N Tagore Hospital. Today I am going to say something about stroke. So what is stroke? Stroke is basically a sudden paroxysmal abrupt cessation of blood supply to brain. So what happens? Whatever we need to remember one thing, that whatever we do, our day-to-day activities like moving our hands, like seeing objects, like walking, everything is controlled by the brain. So when there is any abrupt stoppage of blood to the brain circulation, we will have deterioration in any of this. Like what we can have if a person is having stroke, person will have a facial deviation, person will have an inability to move his legs, person will have some difficulty in speaking, the person may have difficulty in vision, the person may have difficulty in saying words, like naming a thing, like understanding words. Now if we look at stroke, what are the two types of stroke? One is ischemic stroke, second is hemorrhagic stroke. The third thing is very important is, can we prevent stroke? Yes, to certain extent, if we follow control of pressure, control of sugar, control of lipid profile, and have a good normal nutritious diet, have a good exercise, then we can control, to a certain extent we can prevent occurrence of stroke. Now why stroke is important? If we look at the magnitude of stroke, stroke is one of the most common diseases mankind can have. If we look at the recent data, it shows that it states that about 1 in every 4 person above the age of 25 years will have stroke at some point of time. And if we look at it, about 16% of people less than 50 years will develop stroke, and about 60 to 70% of this total population happens in people below 70 years. So it's very important that we look at the symptoms of stroke, at prevention of stroke, to prevent stroke. Now the most important thing, another thing that I want to say is, what happens when a person is having stroke? When a person is having stroke, as I have said, the person will have any difficulty in walking. Now suppose your walking difficulty occurs. If we look at cost of a disease, there is a direct cost, the disease is happening. Another thing is the indirect cost. Why stroke is important? Stroke is very important because in no other disease the indirect cost, the problem with the family falls. Because if you are having any disability, if you cannot move, it's not just you who will be affected, it's the entire family. You need someone to look after you, you need someone to take you to the toilet, you need someone to give you the food. So stroke is very important. Another thing, this year, today on 29th October, we are celebrating World Stroke Day. This year's theme is how to save precious time. Now why time is very precious? After stroke happens, as I have already said, there is an abrupt cessation of blood circulation to brain. So after cessation of blood circulation occurs to brain, with every minute, millions of brain neurons are getting destroyed. Now this destruction is permanent, it will never be improved. So as soon as stroke happens, what you need to do is you take the patient to any hospital, you do CT scan, MRI, you start the medication so that any further damage that can happen can be prevented.